We're in an environment where we're able to collect an incredible amount of data. We're able to store that data. We're able to process it very, very quickly. We have highly sophisticated mathematical algorithms that can make sense of that data to help us live better lives, to do incredibly ambitious things where we haven't had opportunities to do these sorts of things before. I lead a data science group. We're formerly known as the Lee Cushing Center for Healthcare Analytics Research and Training. No one can remember that, so we just call it CHART. We're basically a team of data scientists whose purpose really is to leverage data to apply analytics to improve patient outcomes and to improve hospital efficiency. Healthcare is complex. Clinicians are often faced with mundane tasks and on the other end making very, very complex decisions. The average clinician will spend maybe a third of their time on direct face-to-face clinical care for their patient. The majority of their time will actually be spent on things like documentation and desk work. I think we can help in that end to automate tasks, to do things more efficiently with artificial intelligence. On the complexity side, the average human is composed of over 30 trillion cells and over 40 trillion bacteria. Within each of these cells, there are thousands of processes that go on. It takes one thing to create disease. It's hard to really try and get our head around all of this. If we look at the medical literature, there are over 26 million published healthcare-related studies. It's almost impossible to keep on top of these. There's so much that our clinicians want to do for our patients, but it's challenging with all the information that we have and the complexities. So I fundamentally believe artificial intelligence can help with not only reducing the amount of mundane tasks, but I think it can help us understand and do better with the complexity that is healthcare. We have all sorts of algorithms. We're able to predict days in advance how many patients will be coming to our emergency department with well over 90% accuracy. So we look at the predictions at least 5 to 7 times a day and plan our staffing accordingly.
Within a few weeks of the pandemic hitting, our team had to rapidly deploy a real-time monitoring system around COVID in our hospital. So our team was able to deploy a system that on the hour, every hour, it actually just basically tells you, here's how many COVID patients we have, here's how many under suspicion, here's where they're located. And so then we would actually have a tracking system that is able to tell us exactly where people are and where problem areas are in terms of how things change over time.
We also have algorithms where we assist our nurses in assigning our emergency department nurses to the different zones that they work in. We actually have an AI algorithm that tracks where the nurses work, what types of nurses, if they've worked the same zone over and over again, and it actually optimizes everything within seconds. We've cut human involvement by over 90% in just this task. And of course, what we're excited about is a machine learning algorithm. It's actually a collection of algorithms that automatically pulls data on things like labs, medications, orders, vital statistics. Every few hours, it ingests all of this data and it predicts if a patient is going to die or go to the ICU. And it could do this with considerable accuracy. Now, of course, the clinician may say, and they have said, well, how do I know it's better than me? So we've spent a bit of time. We've went to the floors and we've actually asked our doctors, nurses, and our residents, what do you think? We have over 4,000 clinician predictions. And I can safely say the AI algorithm performs considerably better. And we're anticipating that this will help us be able to identify high-risk patients really early so we can intervene with the right measures to monitor them more carefully, to look for sepsis, to do these sorts of things that will help save lives.
I think we have to position AI algorithms as simply being assistants. I think it was Miller in the 1950s who suggested that the average human can process 7 plus or minus 2 things at the same time before things just start to degrade. I think we have to appreciate that AI can process much more than 7 plus or minus 2 things at the same time and can really help us deal with a lot of the complexities that we struggle with, but it's not going to be perfect. So if we take that context of, I've got an incredibly powerful tool, and when it signals something, I should pay attention, but it shouldn't replace my judgment. I think that's going to be very important for us.